Hello, viewers. For everyone, happy Occupational Therapy Day. You all know that the Occupational Therapy Day is 27th October. This year, the theme is Occupational Therapy in Action. Hi, everyone. My name is Ganapati. I'm the head of the Occupational Therapy Department at PRS Neurosciences. What is occupational therapy? And most of the time, people ask, like, do you give job, or do you do train job, or you do something no, it sounds like acupuncture. So most of the time people ask, like, is it acupuncture? You do acupuncture therapy? So let me tell it very clearly and loudly that occupation means that you are doing something. Of course, that the word sounds like job, but occupation means you are doing anything which we are doing. So whatever the treatment which we are doing is through doing it. Let me tell in the context of neurorehabilitation. In neurorehabilitation, we have brain injury, spinal cord injury patients, or any nerve injury patients would be coming here. So it can be a stroke patient, it can be a head injury patient, it can be a spinal cord injury patient. Imagine we are all normally living our life, we are getting up, brushing, doing all meaningful activities. We have a role. I am a father, I'm a son, I'm a teacher, I'm a owner of a company. So many roles which you are playing. Suddenly you got a neurological problem, and all these activities which you were doing and which you called meaningful in your life is gone, and we become disabled. Then if you have to get back to the routine, then you need somebody like an occupational therapist to help you, channelize you towards your earlier routine. So what occupational therapists do in PRS Neuroscience is we work in multiple places. Like you have physiotherapists, you have a psychologist working with their cognition and mental issues, and you have speech therapists working with language, speech, and swallowing. We have occupational therapists helping these population put them back to their work or their self-care activity. So these are the major areas occupational therapist working. One is self-care, that is taking care of self. It can be brushing, eating, combing, toileting, bathing. These are called skills. That means you lost a skill which you can learn through occupational therapy, because it's all motor learning. Motor learning require cognition, which is software, and you need movement, which is the hardware. So these two things has to work together. So in neurological problems, you can have a software problem, which is cognition, language, and visual problems, or you can have a motor problem where paralysis, hand function issues, walking issues. Now if you have to put them back to their functionalities, you need integration of all these things, and training, proper learning is required. The second area which occupational therapists work is work. If you are a teacher, or if you are a therapist, or if you are a doctor, now you got a neurological problem, you have undergone a brain surgery. After brain surgery, you will not be able to perform exactly the same way you were performing before. Here you need an occupational therapist help to analyze your job, analyze your capability, and match the gap and train them and put them back to their same job again. If not possible, maybe like you have to find out a new way of doing it, new way of job. Here we use two ways of rehabilitation. One is restorative, where how they were performing before, we will reach to that level. The other one is compensatory. There you will do modifications or adaptations. What is modification? You modify the environment or a person's way of doing it, or the task you modify, or you give adaptation. You give build up spoon, build up handle, modifying the changing the creating adaptive tools for computer. Through that you create new way of doing the activities he was doing before. The last thing is leisure. Leisure is basically how meaningfully you are using your free time. Like it can be reading books. Some people, they have spinal cord injury patients, they have quadriplegia, but he likes to read. Now we have to come up with a system where he will be able to move around. He will choose the book, and we help them to read by themselves. So we have patients who are running the business on bed. We train them to use their eye tracking to run his business itself without any hand function like that. And we have patients who have higher level spinal cord injury patients who are not able to use their hand, who are using modified keypad and typewriters, and they are into the work as before. These are, of course, these are a compensatory technique, but still they are the productive members of the community. So every aspect, mobility, doing the job, and taking care of self, and how they are using their leisure, all these things are trained by occupational therapist. We also work with hand function. If they have hand, because hand is a most complex part of the human body. Of course, all other parts also has its own importance, but hand interact with the environment mostly. So this hand has a very unique biomechanics. So if they have any problem with the hand, we deal with that, giving hand splint, static solid splint, dynamic splints. All these are done by occupational therapists. We work with the visual rehabilitation. If they have a functional visual problem, some patients, they have movement issues, double vision, they have field vision, they have perceptual problem, they'll not be able to read properly, they'll not be able to recognize people. All these problems are handled by occupational therapist. And also we work with the psychological and cognitive part of it. Sometimes we work with the psychologist or the cognitive therapist, because we want a functional cognition where they will integrate their cognitive ability into their daily activities. They have to perform their daily activities by themselves. So these are our roles. We go for home audits. We audit the house, and we will suggest modification. We make modification done at the home so that they can move around easily. These are the things mostly the occupational therapist will be doing. So now there are different areas occupational therapists work in. They work in neuro rehab setups, hospitals, and sometimes patients with coma stimulations are done, prevention of disability, so many things, and educating the family members. These kind of roles are played in the neuro setup. And you have pediatric also, starting from neonatal ICU to schooling, putting them back to the community. This is a vast area of role occupational therapists play. And in this video, I am sticking on to the neuro rehabilitation because we are from PRS neuroscience. And psychiatry is another area occupational therapists work, and geriatric population, older people, they have to. So overall, what is the role of occupational therapist is giving them a life which is respected and improve their quality of life, and so that they don't have to depend on anybody. So if you have anybody who is who is depending on somebody, you can suggest them to meet an occupational therapist. He will be able to help you. Thank you so much. If you like this video, please subscribe and click the bell icon. It will be useful for all other people who require occupational therapy service. Thank you so much.